As soon as I see a few more participants start to enter, I'll get this underway. There we go. Well, welcome everybody. Thanks for joining in. First off, I'd like to start with a territorial acknowledgement, acknowledging that we are coming today to everyone from the traditional and unceded territory of the Coast Salish First Nation, specifically in our case here in Nanaimo on the Nanaimo, Suminas, and Sonas people's land, and we pay our respects for that. Thank you very much. We held an event similar to this about 6 months ago, a little earlier in the pandemic, where we shared the understanding that COVID and the conditions that it has imposed on us was really affecting most of us emotionally, mentally, personally. And that happens at home, at work, in our shrinking social circles, now called bubbles, in our communities, and throughout society in general. Back then, our guest panelist psychologist, Dr. David Fairweather, remarked on how much their clinical hours had increased and how the increasing seriousness of issues was revealing itself. Nervous exhaustion, increasing anxiety, intimate partner violence, rising claims for leaves of absence from work for stress reasons. Dr. Allison back then talked about how that was affecting healthcare, hospitals, calls for service, and the issues on our city streets with rising social disorder. The impact of a weakened mental health care system is unknown. There are too many people who need too much help walking the streets of our community. Just witnessed the incident in a Victoria courtroom last week, where it took 8 sheriffs to subdue someone on trial for crippling a Victoria police officer. Can the problems be fixed, and how can we see results sooner rather than later? I'm thinking we're going to get some good news during this talk today. So, on top of these well-known current issues, the province continues to suffer under a significant overdose and toxic drug death problem that seems insoluble. More is being done than ever before, but the numbers keep rising and the problem continues to strike in some unusual places not typically associated with drug culture. So we'll cover a fairly wide gamut today. With us we have Jason Harrison, Executive Director of BC CMHA, Canadian Mental Health Association. We have Dr. Sandra Allison, who is one of Nanaimo's medical health officers. And we have Minister Sheila Malcolmson from the Ministry of Health and Addiction, or Mental Health and Addictions. So let's get the conversation going with Sheila talking about this horrible opioid crisis. And then we'll invite Jason and Dr. Allison to jump in and we'll begin the conversation. Go ahead, Sheila, take it away.
Thank you, Kim. I really appreciate the invitation from the Chamber and really appreciate the Chamber taking these issues on. We don't take it for granted. It's not all chambers that have got this social justice commitment that Nanaimo's does. So I'm really thankful for that. And I know how many resources the business community puts into these issues. I'm honored to be joining you from Nanaimo territory. The legislative session just wrapped up last night, and so really glad to be home. And as you say, Kim, like what a tough time in the province right now. I know that it's close to home. We haven't been hit by the flood impacts in the way that other parts of the province are, but regardless, it adds more pressure to already a real pressure cooker situation. And I recognize too, it could very well be triggering for other times that, members of our community have been in similar events before. So, just how many waves of disaster can our province and our people contend with. There is a new flood response line that's open that has a whole range of mental health supports. So if anybody is feeling triggered or needs help, 833-376-2452 is the new Service BC flood response line. And there's also a website, gov.bc.ca/flood response. It's also got links to all the virtual mental health supports. And, and I appreciate people's feedback on that. If it's something that works for you or you've got ideas about what else should be added there, I'd love to hear it. I know we're going to touch back into some of these other places and elements of what's going on in our community and province-wide, but because you did ask me to talk about the toxic drug poisoning crisis, Kim, I'll start off with that. more lives lost this year than ever before. In Nanaimo, 30 deaths already in 2021. Almost 240 deaths in the Island Health Region in 2021. Over 1,500 deaths province-wide. Despite everything that's being done and how hard everybody's working on the front line, the loss of life, the deepening loss of life is very hard to take, from a distance, let alone I know how many people have lost friends, family members. It is just a soul-kicking number. Illicit fentanyl this year was detected in 84% of drug toxicity deaths. These are the coroner's numbers. In 2012, it was 5%. So this is every year, year over year, exacerbated by the pandemic. Increased toxicity of drugs means people that have managed an addiction, all these, many years are getting felled. So that's why it's so important for us to have been expanding drug testing, to have expanded access to prescribed safe supply, to be pushing out in every platform when there is, and Island Health does a great job of this, letting people know when there are particularly toxic drugs available, and us continuing to fan out more addiction treatment supports, really trying to hit this from every frame. I'm just going to touch on a couple of places where British Columbia is ramping up the response and trying new things. Decriminalization, we're the first province in Canada to apply to the federal government for an exemption to not legalize drugs. Definitely want to say really clearly, this is not what the Prime Minister did with marijuana, but to decriminalize the people who use drugs, illicit street drugs, at small amounts of personal possession. We had a fantastic, very committed core planning table. People who use drugs, people with lived and living experience, police, health authorities, First Nations organizations that work together to develop our application. Really encouraged by the continued level of support from disparate areas and interests. And then I've had my first meeting already with the new federal minister for mental health and addictions. The feds have now mirrored what British Columbia did. Carolyn Bennett and I have met twice on this already, including in person last week. And I'm really encouraged that they're going to see this as urgent. We see decriminalization and decriminalizing the people that use drugs as a way to remove the psychological barrier to asking for the healthcare support that people need. We believe this is a healthcare problem. Addiction is a healthcare problem, not a criminal justice problem, not a policing problem. We've also, so that happened this month. Also this month, last month, opened the Redfish Healing Center on the grounds of the land which were formerly known as the Riverview lands, the Lower Mainland. This is a province-wide facility, and I'll maybe talk a little bit more about the details of the treatment platform, but very encouraged to see that open. Really innovative center and something that's going to make a difference. Also last month announced the $132 million of new funding for treatment and recovery options. That's going to fan out over the next couple of years through every health authority, but some of the things that are specifically either already open or already announced on Vancouver Island, an extension of the Alcohol Treatment and Recovery Center, Indigenous-led in Port Hardy. There are out right now 3 requests for proposal from Island Health, remembering that it's through the health authorities that we deliver all of our provincial spending on addictions and mental health. So Island Health has got 3 RFPs out for new services for treatment and recovery, Vancouver Island, sobering assessment beds in Tofino and Ucluelet, supportive recovery beds in Oceanside, and 8 sobering assessment beds in Nanaimo. So those are out for tender right now. We'll have news on that soon. That is on top of the 20 new publicly funded treatment and recovery beds that we announced in January. They're already open and operating in Nanaimo. 5 of them were at Edgewood, 15 John Howard Society beds, and there is more to come. We're opening new facilities almost every week. A really innovative one again on overdose response that I don't know, Dr. Allison, if you might be able to, lead up if people in Nanaimo want to have a look at this new center in Duncan, supervised consumption site, so that people can bring their illicit street drugs in. Sometimes there's testing available, but regardless, there's a nurse there to supervise and support you while you inject or inhale drugs. Inhalation is the method of choice these days. It does not make you less likely to overdose, but it is something that we need to support at a medical level. But the really neat new piece of, although we've got this in downtown East Side in Vancouver, we don't have very many examples other places. This Duncan Wellness Center model has at one end of the supervised consumption site space is a doctor's office, so people can walk right in. They don't have to get an appointment. They don't have to book for next week. They're getting connected to primary health care and a possible runway to treatment if that's what they choose when they're ready. The other end of the room has got a federally funded safe supply tie-out facility. Again, very innovative with a nurse right there. The stories I heard just on the one day that I toured were very inspiring. What happens when you bring drug, both harm reduction and drug treatment and primary healthcare under one roof really changes lives. And then maybe the final thing I'll just touch on, and more supervised consumption sites are opening in all parts of the province. So there will be more news on that to come. We've already doubled them in the 4 years we've been in government, but there's more need, more places. Maybe the final thing I'll touch on, Kim, is our prescribed safe supply program. We started it up in March 2020. We've seen a 473% increase since then, but the people that are being prescribed safe supply so that they don't have to rely on contaminated and increasingly toxic street drugs. This July, Bonnie Henry and I announced an expansion of that, having heard from both people who use drugs and from prescribers that people needed both more access points and also more different types of drugs, particularly those that actually give more of a high rather than just stabilizing people medically. People that are dealing with trauma, they use drugs for both the euphoric effect as well as the pain management effect. And so we've increased the number of drugs that can be included within that prescribed safe supply. That's getting fanned out through every health authority, notwithstanding our health authorities fighting 2 public health emergencies, everybody being exhausted, and fanning out the country's largest ever immunization program. We're also asking them to expand safe supply and do things in totally new, innovative ways. We're very grateful to them. We know we're asking a lot, but lives are at stake. And so this is another area of work that is more news to come and more results to come. But with that, Kim, I'll turn it back to you. And I know there's a lot more for us to talk about.
Well, just with my questions and comments, I could fill in the rest of our hour here together. There's some very encouraging news in there. When I first learned that Carolyn Bennett had been appointed to that portfolio, I was extremely pleased because I know her to be one of the hardest working women in Ottawa. She is just remarkable, the energy that she has and the energy that she invests in the portfolios that she's given to work on are really something else. She made remarkable progress with First Nations, of course. So I look forward to you and her working together to help some of these problems. Encouraging news, most of what you're saying there, Jason, you have, it's your team that works the streets of Nanaimo, and you have a response team down there on the street. And I'm wondering if maybe you can respond to some of what Sheila was saying, because what we want to see is what the impacts of those moves and those policies and that decision making is. What are the impacts on the street? And so maybe an opinion from you before I go to Dr. Allison, open the picture up a bit more.
Sure, and as you said, Kim, this topic and everything connected to it, we could fill much more than an hour on all of this. I think Minister Malcolmson, the one of the things I picked up on early is about the pandemic exacerbating things. And that is what we've definitely seen is the pandemic has, it hasn't necessarily created the issues, it's created issues for everyone broadly in everybody's lives and disrupted everything. But what it has is it's really exposed what many of us in the working community already knew. And we saw things heading in this direction. And I think we also have to be prepared for the fact that there will be effects after we get through this, after it moves from pandemic to an endemic state. I'm encouraged by everything that Sheila was saying and the different investment that government is putting into all of these areas. One of the things that has really struck me with the response to the pandemic, differing from response to some of the social issues that we've been experiencing and noticing in our communities, is that in Canada and British Columbia, we've had a pretty good response to the pandemic, top marks as far as even globally how we've dealt with these issues, but government backed the health and science approach. And we've had lots of movement, and all of those discussions, they've supported those, where often the things that are happening on the streets kind of turn into a debate over feelings and politics and the visceral reactions of the things that we're seeing. And I think any of the things that we need to do in the future is going to require courageous leadership from people in government, people in our line of work, people in the health sector, people in the business sector, because the economic health of our community is completely tied to the social health of our community, two sides of the same coin. And I think we really need to lean into courageous ways to plan and work with government to land some of these things that they would like to do, because they are going to offer these things to all communities. And I think we need strong direction and collaboration within our community to make sure that those things come to Nanaimo and not just land in the other communities that are ready for them. That's been one of the things that I've definitely struggled with in Nanaimo, is about our ability to communicate our story of and the narrative of the need that we have, and get on that page and move forward. And I think the one example that was the latest, the one that Sheila mentioned there, is the Wellness and Recovery Center, tied to overdose prevention, tied to opioid replacement therapies and access to the supports and things that we need. That is something that we've been advocating for strongly in our community since we opened the first overdose prevention site north of the Malahat in 2017. We've been wanting to have a better location, more robust services, but it hasn't been something that's necessarily been supported in Nanaimo. And I'm really, I'm really excited for what's going on in Duncan with the Wellness and Recovery Center. But there's a bit of a sadness as well, because many of the ideas that we had brought forward have been taken, shared, used, and launched in Duncan, but not in Nanaimo. So we have to find a way to get that support within the community, to work with the health authority, to work with both the provincial and federal government, to make those things happen in our community, and do so in a thoughtful way. Many of the responses that we've had over the last bunch of years have been reactive and much more crisis-based, as opposed to a proactive solution-based place. So that's, kind of sitting on both sides. There are lots of great possible solutions there, but I think we have to get the support as a community to make those things happen in Nanaimo.
And Minister Malcolmson points out that the Duncan Wellness and Recovery Center did face opposition, and that's to be expected. NIMBYism is well and strong even in the middle of a pandemic, when you think our social charity should be much, much greater. Dr. Allison, we'll turn to you and ask you to comment on some of these issues and the local, especially the impact locally. And
Thank you. Very interesting comments so far. Some threads I'd like to pick up on, and certainly our experience during the pandemic has been quite remarkable regarding the worsening of our drug poisoning crisis. When I look at the data from the coroner, during the time of the pandemic, we've seen the rate of overdose or drug poisoning fatalities for both women and men double in rate in that period of time. And so that is, to me, just symbolic of the pressures that are being experienced by the community. There's a lot of volatility, uncertainty, complexity, and ambiguity right now. So our population is really struggling with trying to understand, what do I know for sure? And there are a few things that I know for sure that I think are worth mentioning. And one is that the vaccines and our vaccine program is the way out of our pandemic at this point in time. And certainly we are trying everything within our might to normalize the vaccination, to make it acceptable, to offer as many different formulations that are available, and vaccinating the population widely. What I know for sure as well is that as humans, human beings have feelings. Jason was mentioning how emotions and politics do sometimes guide our decision making, and that is something that we see at times like this. When people are faced with uncertainty and they're looking for things that they know for sure, friends and family are definitely resources to people, but our public health measures have at times impeded access to our most valued resources, which is our friends and family. Humans are really connected beings, and the connection and the healing power of connection is so incredibly important. There is an amazing video called The Great Disconnection by a fellow who's really sought to understand how society is coping. And really it's things like our urban design in our communities. Their communities are quite disconnected, sometimes not walkable. The way our buildings, particularly larger communal buildings are organized, people rarely see each other or make eye contact. And then when we are in presence of each other, our technology and the design technology that we're using in our systems and our platforms really are interrupting those social connections that we want and that are very healthy for us. So what I'm seeing at this time is that this has been like a long buildup to disconnection in our communities, but you add a pandemic on top of that, and people are hurting, really, really hurting. They're lacking that connection. They're lacking that supportive relationship. And it's coming out in our other data as well. BC COVID Speak data, the second iteration of that demonstrates that alcohol use has increased in our population, cannabis use has increased in our population, connection to friends and family has decreased. And so as I look forward, as I think about how we heal as a community, I really hope that together we can emphasize how important coming together is, supporting each other, understanding and offering acceptance of individuals' differing coping strategies. The drug poisoning fatalities are only one impact of these social disconnections. We know that the burdens of alcohol, both in our homes, in our workplaces, and even in our hospitals, is beginning to increase. And so really, while we see these terrible reports coming out about the drug poisoning crisis, I think the same can be said for many different ways we're coping in society. And so trying to understand how we can come back together and reunite and really start healing together in a connected way. I think that that's probably one of my biggest pieces that I wanted to flag. And regarding resiliency, I think that our communities can withstand these stresses so long as we have the protective connectivity there to rely on. And so If we let go of all the connection, I think that we will have less resiliency in our community and a lesser ability to withstand some of these tragedies and disasters that are coming in waves upon us. Thanks for making time today.
There's, yeah, there's certainly no shortage of issues confronting us and challenging us right now. And in the office yesterday, somebody said, great, floods this weekend, when do the locusts arrive? And I said, we're pretty good in that department because it's a little cold for locusts, but the frogs might hit us any day now. And then we'll have that one more thing to deal with. It's a really important point that you bring up about connectivity, and certainly if we can get people back to working together and getting some social exposure in that fashion. I know that we've started to try to have chamber board meetings back live again, and it's hard to get down to the board meeting part of things because everybody's just blah, 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 about what's going on in their lives, what they've been doing, how are you, and what have you been doing, and how's the wife and kids, and those kinds of conversations. And I mentioned before we went live here that the chamber has started to have some of its social and networking events and corporate networking events again. And the energy in those rooms is super, super high. It's like everybody's missed each other really badly, you know, even if it's a business person that you don't know, but it's somebody new coming to a networking meeting. You're like, oh, how are you? What have you been doing? What's up? What, you know, how have you been coping? What are you doing? What are you going to do next? And so I think we're also very interested in how the next person is doing and how they've been, you know, keeping it together at home, at work, and in all places. But Minister Malcolmson, we were talking about some of the resources being brought to the community. Dr. Allison, are we on point with what's coming here? Is it all the right combination of things? And I'm not going to presume that you don't speak to each other, or there isn't an absolute connection between the minister and the health authority. So can you want to expand on that a little bit, and then we'll talk to Jason about what else is needed soon.
You go ahead, Minister Malcolmson.
Yeah, you know, I would say, like, just to come back to Jason's comment about the Duncan Wellness Center, I really have to give Island Health credit for just, like, there was so much community opposition. I was in an hour-long meeting with the Premier in the middle of a pandemic, explaining to people why, you know, coalescing services under one roof really was going to be better. You know, the neighbors really opposed concentration of services. And I think it was Island Health's doctor, and I'm sorry, Dr. Allison, I'm going to forget her name,
Dr. Waters.
Shannon Waters. She just said the most beautiful, you know, said, I recognize you think that this might be hard for your kids to see people who are homeless or who use drugs, but I know it's hard for kids who lose their parents to overdose. You know, she just had this is a medical problem. This is an Island Health-led medical solution. It was so powerful. And I was only just a minister. Actually, today's the anniversary of me being named minister. And this was one of my early meetings. And I remember hearing Dr. Waters thinking, that's what I should have said. That's the kind of leadership that I should have exhibited. It had a huge impact on me. And here we are, a year later, the center has opened. It withstood the opposition. So the thing that is really great is that there is an Island Health-wide team that is very connected. So we're not only working with Nanaimo people on what Nanaimo needs, we are working with the specialists who can draw from, this is what worked well in Duncan, and this worked well in Campbell River, and come on, Nanaimo, say yes to this. You know, so I just want, you know, people here to know that there is that very strong public health framework gap. So we don't need to reinvent the wheel, but siting is a problem. You know, like we got 14 months ago, I secured only the second homelessness navigation center in the province for Nanaimo. We've been unable to site it. And that would be 60 beds, bridge to homelessness for the people that have been the hardest to house. So, you know, we need to keep the pressure on that. We can't implement this without support of city council and without the support of landlords and business people that are willing to host it. And we've been stopped, you know, for both of those reasons. Maybe another piece that I'll say, which isn't Nanaimo specific, but it comes back to your comments at the very beginning, the intersection of mental health, addictions, and extreme aggression. This is extremely hard on hospital workers and on frontline mental health workers, people that are, and maybe Jason can speak more directly to this, but the aggression from the power of the different drug mix that's out there means that there are some intensely strong and angry and out of control people, very hard on folks on the front line. We've also had traditionally in British Columbia, barriers put up for people that are contending with concurrent mental health and addictions challenges. They sometimes get told they're at the wrong door, but it means that in effect there is no door. That's one of the things that's so powerful about the opening of the Redfish Healing Center in Coquitlam, 105 beds. It is a province-wide resource, so people can come from any part of the province to be there. It is particularly designed around aggressive behavior, which means that sometimes there aren't the local resources to contend with them. There is also a locked section, which is for people that are held involuntarily under the Mental Health Act. We also opened earlier this month 10 new treatment beds at the Phoenix Center in Surrey, again, particularly focused on people that are dealing with addictions, but also extreme aggression, which makes them very hard to treat other places. Province-wide, we're funding more into early psychosis identification and treatment, $53 million into that. But that's more about prevention and getting in while the problems are still small. But your opening comments, Kim, were about the final manifestation of untreated mental health and addictions. And we are adding more medical resources for that, which are available to Nanaimo people, even if they aren't cited right here in our community.
Jason, can you talk about just what Sheila was mentioning there, the changing drug supply impacting behaviors on the street, the increase in aggression? I sit on something called the Security Summit. We meet every 2 weeks to have a discussion about observations in the community and behaviors that are becoming outstanding in the community. It's sort of an amalgamation of a bunch of business leaders, community leaders, RCMP, city bylaw enforcement folks. And every time we meet, we seem to have some new phenomena that seems to be rising. Can you address some of that?
Yeah, I mean, it is true. Definitely the resurgence of the types of drugs that are out there right now is contributing to it. We've had bouts with that in the past. Those types of drugs have gone away. Some of those things went down. But I think the thing that I'm struggling with is it actually that, or is it also a volume issue? There are so many more people out there. If you just look at the basic stats that we have around homelessness, there are just it's orders of magnitude almost more people out there. So you're seeing more of that behavior. There might have been that behavior before, but there weren't as many, so it wasn't as visible. We definitely are seeing a lot more disruptive and angry folks that we deal with, marginalized, struggling because of their own challenges in life and what might be available to them. And I think it all really does go back to what was already mentioned about connectedness. Connectedness isn't about just those of us that are housed, that are doing okay. It's a humanity thing. And I think I often have told people for years, we're not in the mental health and substance use business, we're in the relationship business. So when it comes to our workers connecting with people that are having those kind of issues, sometimes we have some success, managing and mitigating that for folks, but that's based on previous relationship. That's because they know you, as opposed to an aggressive approach to somebody that's having that challenge. So yeah, I'm not quite sure myself if it's straight about drug use or mental illness or mental health, or just we're at a point where you know, this is prevalent everywhere. There's macro forces. This is all across Canada. This is all across North America, and it's all across the world, really, in many respects. And it is very complex. It's tied to poverty. It's tied to access to resources, to housing. And there isn't a silver bullet for any of it, but empathy, compassion, connectedness, providing opportunities for people to not feel out there and on their own. They may have a different and better response, and it's okay. You know, I think about it, we're all tired. We're all exhausted from what we've been going through. I know I'm not my best self. And I know pretty much everybody out there is in that same way. I can only imagine, and I can't imagine what it is like if you're forced to sleep in a doorway, or you're being asked to put up a tent in the morning and take it down at night, or sorry, other way around. See, not at my best. Put it up and you have to take it down in the morning. Well, we've all probably camped being in this part of the world. What are the two worst parts of going camping? Setting up your camp and putting it and taking it back down when you go for your weekend or your week. We're asking people to do that on a daily basis, but then also be their best, be respectful. You know, people are hungry, tired, cold, going through all that kind of stuff. So we have to have some compassion and some empathy for folks that are just trying to do their best. And I think the last thing that they'll put in, and I actually probably should have put it up front, a lot of the attention goes to that disruptive piece, and we need to have the right resources for those folks. And in most communities, we don't. But we can't forget that other 80–85% of folks that are not showing up that way, that are, you know, there are lots of folks that are homeless that are not represented by the group that are kind of creating that disorder. And we can't forget that the bulk of people that need that support and need those resources and the things that we're talking about in a wellness center aren't just for those that are causing disruption. It's for those that are still trying to maintain jobs while living in their car, trying to raise their children, you know, all those other types of things. So yeah, it's just, we can't lose sight on that. I know Dr. Allison will probably.
Yeah, I just really wanted to comment on just some perceptions around the drug supply, the illicit drug supply, adulterants therein, and behaviors that arise. And I do think, Jason, you touched on something, is that there's just a general pressure on society where people are misbehaving. I certainly hear it from my enforcement officers that our compliance checks are very difficult to perform. Communities are very challenged to follow the public health orders, very disruptive, and it doesn't require, you know, being a substance user to become extremely disruptive in society in this day and age right now. Regarding what adulterants are present, we do have the Vancouver Island Drug Checking Project, and the latest results from October show that 6 out of 10 samples of opiates in the street supply are contaminated with very strong benzodiazepines. And so when we think about risks to users right now, something that I'm considerably worried about is individuals who are using that become dependent on benzodiazepines, and that's not a good drug to become dependent on. But also they have very high sedative properties. And so they are very vulnerable when they're out in public because they're not actually being disruptive. They are completely put to sleep by the sedation effects, and they are so vulnerable to being robbed or exposed in the outdoors. So I'm seeing that far more as I walk through the community. If I see someone, I will stop and I will talk to them and I will ask them if they're, you know, I'll try to rouse them, because I know that people are dying in our community, and I will try and prevent that in any way I can. So just perceptions around people who use, really important to understand that they're humans too. And I think that that's something we lose sight of at times.
I don't think there's many of us who, you know, went through this atmospheric river last week that, you know, your thoughts didn't go to those folks downtown and in the doorways. And I just feel terrible about it. I guess that's why I'm a member of the Homeless Coalition, the Mayor's Leaders Table, SPO, and those other
Take it
things.
one step further, just the ideas around coronavirus. So individuals, you know, their belongings are completely soaked, but then we get asked questions about, is it appropriate to run dryers, you know, and yes, please dry people's items. It's very, very important. There's no risk of coronavirus from using a dryer. And so the worries and perceptions around all of this get conflated into unreasonable, unmanageable risk perception.
Very easily, very easily. Minister Malcolmson, what do we have to look forward to? What's, I mean, we know the recovery center, the 60 beds for Nanaimo is a serious challenge. I know we've been looking for sites. I know we've gone back 2 and 3 times to some of the sites to see, okay, can we talk a little bit more about this? What do you foresee? And I'm going to ask you the same thing, Jason, because you and I have talked about this lots.
I think I'd focus on 3 things. The fanning out of that 132 million on treatment and recovery is going to result in a lot of new announcements on Vancouver Island. And some of those are going through the tender process right now. Really grateful to Island Health for leading that, but so watch for news. There's going to be, you know, almost every week we're opening new facilities. The complex care housing work that I've been assigned, which is something that people in Nanaimo particularly will be familiar with because Mayor Krogh has talked about it so often. It's not actually all the way to the Krogh model, but we're calling it really kind of super supportive housing. And actually that's a bit hard for Nanaimo too, because we don't actually have supportive housing really here. We still have the temporary trailer housing that was dropped in workforce housing trailers because the previous council hadn't been willing to say yes to zoning it. Again, back to that leadership piece. But we can look to Oceanside and we can look to what's being built on Nichols Street and is going to open, you know, any week now for purpose-built supportive housing where there is that more intense layering of healthcare supports. And admittedly, we didn't sufficiently fund or at least make the agreements with the health authorities early on to be sure about the medical supports. That's something that Minister E.B. Dix and myself are really focused on. So we're going to have better supportive housing, but still there are some people for whom that isn't enough. And so that's what we're calling complex care housing. It isn't forced incarceration, but it is going to be more specifically designed for people with particular aggression issues, maybe mental health, hoarding, inclined to light fires and do other things in other affordable housing or supportive housing that might threaten the building or threaten other residents. So something with much more intense healthcare supports. We've asked, so that's within my assignment. It's going through the approval process now, and we're going to have news on it, you know, in the weeks ahead. But a piece of news, this is going to be delivered through the health authorities. Another thing that we're asking them to do, we asked for proposals from the health authorities, particularly looking at what is something that we can implement very quickly. Where, for example, is there another kind of healthcare facility being built or opened that we could add maybe a floor of residences that would be within this complex care housing framework, something that's appropriate for people with acquired brain injury or we got 120 proposals from across the province from all the health authorities. I mean, that's a phenomenal recognition from the health authorities that this kind of healthcare infrastructure is needed. We're not going to be able to build 120, but I'm just letting you know that we have a lot of examples to draw on. So that is hopeful coming ahead, and around that intersection of supporting people to live with dignity, incorporating the healthcare system into homelessness, mental health, and addiction is something that is a top priority for the Premier, something that he asks me every other week why it hasn't happened yet, and something that we're working between ministries to try to push. I mean, you wouldn't know from looking outside that in the 4 years we've been in government that we've housed 7,000 people who were formerly homeless. Like you wouldn't, it's such a rising tide in every way. 50,000 people from across the country moved into British Columbia this year. You know, we continue, I'm not saying homeless people, but just people from the rest of Canada, we continue to be a place that people want to come. And I'm not saying that, these are outsiders. It's just there are a lot of souls out there. And notwithstanding the unprecedented investments and structures that have been put in place, there is so much more work to do. And we're going to draw on all supports and all talents to be able to make that go. People like Jason and people like Dr. Allison and people and members like the Chamber.
It's phenomenal when you cite that number of 50,000 moving to British Columbia. In the Vancouver Sun a week ago Saturday, not sure, it was on a Saturday in the last couple of weeks, there was an article on the numbers of people who are moving to British Columbia and are not moving to large cities, but are selecting secondary urban centers like Nanaimo, Kelowna, Kamloops to move to in phenomenal numbers. And we're going to continue to see that here. And that is a whole population of people. It covers all the levels and all the demographics within that 50,000. So we will see people that we want to see here, and we will see people that we're not exactly happy to see here because we lack the resources to support and help them. Dr. Allison, have any comments on what Sheila was just saying about what's coming and what we have to look forward to? And does that come as good news for you, or are we still wanting?
I think we'll still be wanting for housing for quite some time. I don't know that we have a true denominator that we understand of people that require housing. And I think that our city has done a really good job with the Health and Housing Task Force and trying to move forward some of the plans in relation to that. A spectrum of housing is generally what's needed, and it sounds like we're getting better at it. We're getting more refined in our definitions and what resources are needed, but still there just hasn't, to date yet been enough housing stock for everyone. And so affordable housing, it doesn't necessarily meet the needs of all people. And so just trying to understand what are those models. And I know the ministry and the government of BC is very interested in understanding the effective models from elsewhere. So that to me brings hope. Regarding recovery after the pandemic, when I get out of bed in the morning and the first thing I read is about a new variant from South Africa, I worry that we may never get out of this. But yet, 4 hours later, medical health officers discussing, experts across the world, and we're trying to understand what is the relevance of this. I wonder sometimes if we react to different threats in different ways. And so certainly that gets my attention first thing in the morning, but I think we've got really remarkable threats in our communities. And we're faced with 4 atmospheric rivers coming in consecutively. We had a heat dome in June. And I do believe that as we come out of the pandemic, we are going to have to figure out how to continue to work together in new ways. I think the pandemic has really forced us to understand how to work differently. And I think that we are being taught lessons all the time. And if we fail to learn them, we will be retaught the lesson. But I think that the pandemic lesson has really led us to think differently. And if we're going to be successful in the province of British Columbia against next year's forest fires, we are going to be continuing to develop our collaborative approaches in our communities to be able to respond rapidly, protect our most vulnerable, and the infrastructure, our very valuable infrastructure that we're seeing can be wiped out in one atmospheric river, apparently. So ongoing concern for the health of the population, but knowing that we have people like the folks that are here with really good intention and attention to issues, I think is promising for the future, Kim.
Thanks very much, Jason. Over to you. I'm back over to what Sheila was mentioning.
Yeah, I think first, what Dr. Allison is saying is bang on, in my opinion, and we do have to get to the point in a community where we have discussions and have space for all the different voices, and we have to come up with our longer term visions and plans that are really informed by all the different communities. It can't be just one or the other. Government, and we shouldn't also put it all on one. It shouldn't be all on government to come up with the solutions. They have a piece to play. There are people in the working community, they have a piece to play. There's the people that are actually in need that we have to listen to about what are the things that will be impactful to them as we build those plans. And I think we can do a much better job of that if we're able to land a properly constructed system planning organization in Nanaimo. That would be helpful. Is it a silver bullet? No, it's a tool. It's a way of connecting. It's a way to prioritize authentic engagement, where we value people's time and their voices and their input. And we bring that together to chart a path together that we can all get behind. None of us are going to get 100% of what we want. That's just not how our world works. But we can broaden the circle of people that are invited in. We can share the information that people need to be meaningfully present in those conversations and not be excluded and feel like they're not part of it and things are being imposed on them. And I think if we lean into those things, then when we do get to these times of crisis, we can step back and let those that are the experts in that area, we need the engineering folks to look at highways and bridges with the things that we're doing. We need the health folks and the MHOs to look at what do we have to do moving from pandemic to endemic and how to get back to those other places, just like we need the folks in government to be able to navigate those conversations on that level and funding and how we do that. So I think really it comes down to we have an opportunity to look at better ways and we don't have to reinvent the wheel either. There are people that are out there that are doing great jobs that we can take that information and then mold it to what our community looks like. And I think, and that's in all the different areas. And we do often get stuck on, supportive housing. The models work. The models work if they're funded correctly and we have those resources there. I mean, the one thing that I would say, when we're talking about that piece of things, we opened the first one that was under the Provincial Homelessness Initiative back in 2012. And at that time, the homelessness problem was smaller. We didn't have as many people on the streets, but we're still housing the people that were the visible faces of homelessness at that time. In our building, half of those folks are still living there. They've been able to find a different quality of life. They're not those folks that are on the street, but time continues on and there will be other things that happen and we have to look at those issues and try and come up with plans that work for us in the community. There are organizations like I think Nanaimo Affordable Housing was referenced earlier. That was a project that they really took leadership on and got support and they're opening a ton of affordable housing that isn't just supportive for street entrenched folks. We do need that as well. We do need wellness centers. We do need probably a low barrier shelter because we've gotten to a certain place where we need something that meets the needs of those folks. And I think we have to come together and just have agreement that if we don't provide these things, we will get what we get. And I think, Minister Malcolmson referenced the temporary supportive housing pieces that were that was a response. And even the housing that is being built right now to replace them, we got to remember that housing and those pieces right now were not actually, that didn't come about because of negotiation and conversation in the community about what was needed. That was because 300 people gathered down at the port and demanded housing. If we don't find ways to get together to chart out a plan to be able to site a navigation center that we got the funding for, but we can't come to an agreement, there will be other action that does take place that will force our hand and we will get things that we don't necessarily want. So do we want to take control of mapping those things out, or do we want to get forced into those places? Because the problems are real, and I don't think we can ignore them. If we ignore them, you know, your guess is as good as mine as what we will get next. So that's where I'm just encouraging people to use the resources and use the knowledge that is out there. We try and bring it together and get behind something that'll make the community healthier, which just makes everybody healthier, is my hope.
Yeah, I would agree. I would agree. Sometimes it seems like the most daunting task in the world. I joined the Homeless Coalition about 4 years ago now, and had been hearing about the counts, the homeless population counts. And now, of course, I've been monitoring them really closely. We seem to be working harder and harder and doing more and more, and those numbers keep rising. I don't know if that's really the best metric to be following. But maybe a final question here, and that's simply on each of you: optimistic, pessimistic, pragmatic. Where do you fall in what the future holds for us? Start with you, Minister Malcolmson.
Thanks, Kim. I think that that we are here and doing the work. Says, well, I'll speak for myself. I'm an optimist, and it's but that's been a challenge to sustain that over this past year and a half, no question. The fact that we're doing the work and that I see what's happening behind the scenes in government and what is in the works gives me a great deal of optimism. But I'm also discouraged that despite heroic efforts, the loss of lives to overdose, the increased pressure on people, the more visible mental health, the increasing numbers of homeless people, as folks move in to Nanaimo and take up rental housing, it results in evictions, it results in less available supply. There's so many factors at play here. So I will never gloss over the enormity of the challenge and the imperative to keep supporting positive solutions and keep our government investing to build that social infrastructure back up after a very long time of dangerous neglect.
Yeah. Dr. Allison, what about you? You made a really great comment before about full spectrum of housing. And I think some of us fail to understand that, as we try to progress homeless people into supportive housing, and then as they find a better way forward, we don't have enough affordable housing for them to move into, to get them out of the building that Jason was talking about, which is still half full of people who arrived there originally. So that's a very real thing. But optimistic or pessimistic, where do you fall?
Oh, I'm an eternal optimist. I think that's why I'm in public health. Regarding our way forward, I do think that we've been faced with repeated challenges and we've bounced back every time. So I know that we will continue to bounce back. However, we can see our resiliency draining with every time we bounce back. And so I think that, again, going back to the encouraging words about where do we get recharged, and it's through connection. And so healthy connections, make sure your family's vaccinated, ensure that you have things that you know for sure that are within your control, the things that you can control. And if possible, make sure you're taking your vacation time. Everybody needs to take their vacation time. I booked a vacation today. That's why I'm probably smiling.
Good for you. Jason?
That's funny that you say that. I was supposed to be off all of this week, and I've taken half a day. I keep kicking it to the next week. Those of you, especially Kim, that knows me, I think I'm an optimistic pessimist or a pessimistic optimist, usually, which somebody said, oh, you're a realist. Generally, though, I have optimism. There are great people doing this work. There are great people that care about the community and trying just to do better and improve all the time. So there are great opportunities out there, and I'm still optimistic that we're going to be able to take advantage of those. And, you know, like everyone else, tired with frayed nerves, and sometimes it feels like you're on the roller coaster. But generally optimistic that, you know, we're going to be able to make change, even though it's one of those things that it's, I often say in my position or in line of work, where there's no instant gratification. The things that we're trying to do, we won't see their effects for quite a long time. And I think one of the things people tend to do is that when we make that decision, you know, we plant that fruit tree, they want fruit tomorrow. And we got to realize that we got to tend that tree. We got to do those, you know, do those things so that that fruit is healthy. A few years later, you're going to get a couple pieces of fruit, but those big harvests aren't till down the road. So we can't just go plant this thing and go, you didn't see the result tomorrow, so it didn't work. I think we have to know, we have to choose smart things and do the things that we need to tend to it, so that we have that down the road, that we didn't get into this overnight. We're not going to get out of it overnight. So we have to retain that optimism that there's good people working towards this, and we will make a difference. So yeah, I'm still leaning on that side for sure.
Well, it's nice to be in the room with three other optimists, so I'll say that then. But yeah, you have to be optimistic in this work in order to keep moving forward, in order to keep pushing yourself and keep accelerating towards what we hope is a positive outcome. But I have realized that I didn't get onto the Homeless Coalition, and then onto the Health and Housing Task Force, and then onto the Systems Planning Organization, thinking that one day I'm going to wake up and go, oh, look, it's all done. We're finished now. We can go home. Probably in it for life now, one way or another. And we will prevail. We will succeed. Maybe with small steps, maybe once in a while we'll be gifted with a giant step. But I fully agree with the three of you that the future looks better than the past. So thank you very, very much for coming. Enjoy your vacation, Dr. Allison. And happy anniversary, Minister Malcolmson. That's remarkable. You've done great work. Really appreciated by the community. And Jason, you and I will just keep struggling in the trenches. Have a great weekend. Have a great holiday season. Thank you all for your time. Talk soon.
Thanks to the Chamber.